Good morning, students. This is the third series of the give reasons. So the first question is tetany in hypoparathyroidism. We have seen in the earlier class, earlier session, tetany occurs in hypothyroidectomy in case of thyroidectomy. But in this question, tetany occurs in hypoparathyroidism. Tetany is a condition where the body is deficient of calcium. So tetany is usually caused by low calcium level, and hypoparathyroidism causes low calcium level and also long-term tetany because parathyroid hormone or the parath hormone is the one which helps in the absorption of calcium from the body. So when that hormone is deficient, the absorption of calcium will not take place and the body tissues will not have enough oxygen, enough calcium. Sorry, not oxygen, no, so less calcium. So hypoparathyroidism is a condition in which the body does not create enough parathyroid hormone, and this dramatically lower the calcium level, which can trigger the kidney. Sometimes kidney failure or problems with pancreas also can interfere in the calcium. Hyperglycemia occurs in the insulin deficiency. As we discussed earlier, insulin is the hormone which controls the amount of glucose in the body. When we take food or when we take any glucose content food, the insulin is the hormone which converts the extra glucose into the glycogen and store in the liver. But in the absence of insulin, there will not be any conversion of glucose into glycogen and storage will not occur. So whatever glucose available, it will be in the bloodstream. So that is the condition called hyperglycemia. When deficiency of insulin both increase hepatic glucose production to the increased glucogenolysis and glucogenesis with decreased glucose use. This results in hyperglycemia. Edema in hypo-proteinemia. Decreased serum protein reduces the oncotic pressure of the blood, leading to loss of fluid from intravascular compartment to the extravascular compartment, which cause edema. So hyperproteinemia, the things you have to keep in mind, there is a decreased oncotic pressure. So there will be a transmission of fluid from the intravascular to the extravascular, and that we call it as a edema. Carbon monoxide causes anemic hypoxia. Carbon monoxide is with the carbon monoxide positioning, the carbon monoxide binds the same receptor site on the hemoglobin as the oxygen, but it has 200 times affinity towards the carbon monoxide. That means the hemoglobin which attract or which bind with the carbon monoxide than oxygen 200 times more. So the carbon monoxide poisoning occurs in the carbon monoxide mix and bind with the hemoglobin. Once it is mixed with the hemoglobin, it is known as carboxyhemoglobin. This carboxyhemoglobin cannot it get the means it when the carbon monoxide bind to hemoglobin and carboxyhemoglobin is formed, less oxygen transport to the body tissue and vital organs, thus brain and heart will not get enough oxygen, and this lead to anemic hypoxia. Physiological contractures occurs when the muscle is fatigued by repeated stimulation. When the ATP supply fails to meet the consumption of ATP during exercise, fatigue occurs. Muscle fatigue defined as the inability to maintain a desired power of output resulting from muscle contraction against a load, that is, which a decline in both force and velocity of shortening, that causes a physiological contracture. In case of a continuous exercise or repeated stimulation, the availability of ATP will be decreased. Edema occurs in Cushing syndrome. There is an increase in angiotensin activates the renin-angiotensin system, which leads to angiotensin-mediated vasoconstriction as well as increased plasma volume. In addition, mineralocorticoid effects of cortisol and hydrocortisone lead directly to sodium and water retention. That is why edema in Cushing syndrome. Polyuria in diabetes insipidus. Polyuria. Diabetes insipidus is a condition where there is a deficiency of antidiuretic hormone. So decreased secretion antidiuretic hormone, that resistance to kidney effect because of the ADH is the one which helps in the reabsorption of water and storage of water. But when there is an antidiuretic hormone is deficient, the water will not be reabsorbed, so it will be excreted as the bladder gets filled and we have to feel the urinated. Edema occurs in malnutrition. It is same with the low proteinemia, because in malnutrition the protein amount will be less and the patient is having proteinuria, and this kidney and liver disease also can cause edema. Proteins, so there is a decreased oncotic pressure. Food does not enter the respiratory tract during swallowing. The epiglottis drops downward to prevent the food from entering the larynx and trachea in order to direct the food into the esophagus. Height of a person does not increase in acromegaly. Acromegaly is the condition where the growth hormone is increased. Hormone, the pituitary gland, and too much growth hormone in the adulthood. When the person is too much growth hormone, the bones increase in size. In childhood, this leads to increased height, but in adulthood, already it will not see, it will cause gigantism. In childhood, it may cause in gigantism, but in adulthood, when there is already the bone is formed, it will stop this development, and it may cause the height does not increase in acromegaly. In adulthood, the increase in growth hormone in adulthood is known as acromegaly. In the childhood, it is known as gigantism. Okay, thank you. The remaining portions we will see in the next session. Thank you for listening.